I hope you enjoy this review and find it helpful in your studies. You can get full ad-free access to the MedEd 101 Nursing Pharmacology Review course at meded101.com/nurse. MedEd 101's Nursing Pharmacology Review course is built to make meds finally click. You'll get nearly 20 hours of ad-free, on-demand video lessons, downloadable slides you can study from, over 40 cheat sheets and study guides, and practice questions to assess what you know. Whether you're preparing for exams or building real-world confidence, this course is designed by pharmacology experts for nurses. Stop memorizing, start understanding pharmacology at meded101.com/nurse. I'm going to cover some of the basics on ethical considerations when it comes to medication management and working with patients. So a lot of these are going to be kind of definitional and good things to remember as far as exams and those type of things. So patient autonomy, respecting a patient's right to refuse medication. So that's an important tenet in medication management. Recognizing that medication decisions are voluntary and informed and not forced onto people, okay? Also, managing situations where a patient refuses a medication that is clinically important. So, understanding how to navigate that situation, and typically, it's a lack of understanding in my experience, why we're, taking apixaban, for example, for atrial fibrillation to prevent blood clots. Many times when patients want to stop medications, they don't understand or they don't recall why they're on it in the first place. And they kind of have this feeling of, what's the point? I don't even know what this medication is used for. So many times in those situations, it's an educational issue as far as a patient's lack of understanding in why they refuse the medication. Informed consent. So this is making sure patients understand why they're receiving a medication. A lot of times, if it's a high risk medication, we'll actually want specific documentation on this, that a patient has been informed of the potential risks and benefits of that medication. Sometimes in some settings and situations, we'll want a signature on that informed consent saying, hey, we did this education. They are aware that there are risks to, giving this blood thinner, giving this antipsychotic, giving this opioid pain med, but they're signing off that they recognize that there is risks to taking or utilizing this medication. Or, potentially if they're incapacitated, they're in an ICU type situation, you might obviously have a caregiver sign off on that. Balancing limited time with the ethical requirement to educate. So, I well know nurses are very, very busy, and it's easy to say, yeah, you should take 5 minutes and educate that patient about their new blood thinner medication. Well, yeah, it's something that we have to do and we have to get done. But at the same time, we've got to figure out that balance of, well, I have to deal with this emergency situation too. And so, recognizing that, okay, maybe we can't do it right now, but recognizing that needs to get done at some point. And, that goes again back to kind of teamwork, hopefully, and making sure that we're all, working together as a team. And, hey, maybe you can ask the pharmacist to step in and say, hey, could you educate that patient, on this medication? I've got XYZ to go do. And so, again, trying to pick up each other, work together, very, very important thing in healthcare, of course. Understanding and addressing language barriers, also associated with that, health literacy, cognitive impairment. These are all really sticky issues. And you need to have an understanding of where your patient's at as far as their understanding. If you go on a 5 or 10 minute rant explaining a medication to them, or how this is going to work, or how an inhaler works, and they don't speak English or not very well, everything is going to go over their head. And, A, you wasted your time, but, B, maybe more importantly, that patient still isn't going to understand what you're saying. And so, where we need to get, interpreters involved and those type of things, that's an important thing to make sure that is assessed, and is an important part of informed consent, making sure that they can actually give that informed consent with the way we're providing that education, for example. Justice and fairness, so providing equitable pain management without bias, recognizing some groups may be underserved and those type of things. That's an important thing to recognize there. Ensuring vulnerable populations receive the same quality care as non-vulnerable populations. Reducing or avoiding stereotyping is an important thing to do as well. So again, these are kind of tenets along the lines of justice and fairness in healthcare. Confidentiality, so we want to protect medication and patient-specific information. I would say particularly with regards, or where this comes into play, is with regards to sensitive type medications. So medications that may be embarrassing or stigmatized for patients. So HIV patients, that can be definitely a concern there. Psychiatric medications. So, some people might not want to know that, hey, I'm on lithium, I have bipolar disorder. They may have been stigmatized in the past, and, people making fun of them or calling them crazy or, whatever the case may be. So those are important things to think about when we're thinking about confidentiality. One other one I remember in my career was a sexually transmitted infection. So, taking an antibiotic for that or taking an antiviral medication for that, that can be a really, really sensitive thing for some patients. And if there's any concern, about others overhearing that or knowing that information, we've got to make sure that we're having those conversations in a confidential space. Avoid disclosure in public places, in front of visitors, people, and so on and so forth. So I think that's common sense, but in the midst of a busy day, that may get lost or may get forgot about. But it's something that we certainly have to do to keep that confidential. Ethical challenges with high-risk medications, so handling opioids responsibly. It's a huge challenge. I've worked in an opioid tapering clinic before, so balancing pain relief, withdrawal symptoms, risk of addiction, all that stuff. It's very, very challenging for sure, and it's a good example of a situation where you really want to work with your team on that. If you have questions or concerns about, they're, asking for more meds, more prescriptions, they're asking for it earlier and earlier, that's a great example of a situation where, we need to make sure we have everybody in the team involved, and we handle that situation in the most, fair and just way we can, and recognizing the issues associated there. Navigating sedation, restraints, end-of-life medications. These are all, sticky type situations, ethical type situations, where, again, I think if there's questions, if there's concerns, involving the care team, asking those questions, asking a colleague, leaning on others is an important thing to do if you're unsure what the best course of action is. All right, we've got a couple terms that are sometimes very hard to pronounce. Beneficence and non-maleficence. So basically, beneficence, the first one, is the act of, doing good, showing kindness, charity, mercy, and actively promoting the well-being and benefit of others. So the way I equate this to medications is making sure those medications have benefit, and that benefit outweighs the potential risk. That's really the goal in medication management when we're starting new medications, making sure that benefit outweighs the risk. Now, non-maleficence is the ethical duty essentially to do no harm. So making sure that we aren't harming patients with the use of, in this case, I guess we're talking about medications, but in the case of any medical intervention that we do. Okay? So recognizing that there is harm and, ideally, the ethical duty is to do no harm first and foremost to those patients. So that could be, allergic reaction, could be a contraindication, could be a drug interaction, so on and so forth. Okay? And any medication that we do, we want to make sure that it's not done if it's unsafe. Okay? So that's always, the challenge in drug therapy. All drugs can cause harm. There's no doubt about that. But they can have significant benefits as well, and that's why we use them. If they didn't have any benefits, we wouldn't use them. So very, very important, weighing risks versus benefits. I mean, that's really what these two terms come down to. Following orders versus advocacy, addressing unsafe or unclear orders. I kind of alluded to that previously. And then again, kind of having that gut feeling or understanding when to challenge and clarify a prescription. And again, if you really don't feel comfortable with something, I would encourage you to ask a third party. That's what I've always done in my career. Where I've seen something, I've asked a provider to change something, discontinue something. I've and they totally didn't agree or they disagreed, and I felt the patient was still potentially being harmed. I've gotten medical director involved, those type of things, and consulted them for kind of advice and guidance and what their thoughts is on the specific situation. So I would encourage you to do that when something doesn't feel right to you. And you're not getting a good answer from maybe a superior that's trying to help with that patient case as well. And then, reporting those concerns. If it's a chronic issue with a specific, provider, that should be something that's, addressed by, a committee and by people that are running the given institution and those type of things. So again, can get into some difficult, ethical challenges there. The easiest way I've always kind of ran my career is focusing back on the patient. Like, what do I think is best for the patient? And making sure that I'm not harming that patient by not stopping something that I think should be stopped. And so I kind of use that to guide me with how far I want to push on something that I disagree with. Struggling with nursing pharmacology? Would you like a resource you can put in your hands? You're not alone. If you want to understand medications instead of just memorizing them, check out the MedEd 101 Guide to Nursing Pharmacology on Amazon. Written by a board-certified clinical pharmacist, this book breaks down high-yield drug concepts, clinical pearls, and real-world examples that actually stick. Perfect for exams and the bedside. Whether you're in nursing school or already practicing, this guide helps you build confidence with medications fast. You can find a direct link to the 233-page book right now at meded101.com/nurse. That's meded101.com/nurse.